Have you ever wondered why some perfectly healthy people still end up with heart disease? Today's guest, I'm having him back for round two. His name is Dr. Paul Anderson. He's an expert on environmental toxicity and innovative cardiac care. He's here to reveal how Therapeutic Plasma Exchange, TPE, and advanced testing are totally rewriting the rules of cardiovascular prevention. Let's dive into it. All right, Dr. Paul Anderson, thank you for joining me. Round two. How are you doing today?
Doing great. Thanks for having me again.
Of course, yeah. Well, I mean, you're very fascinating. I know you've, Dr. Savage was hanging out with you at your event recently,
Yeah.
and I enjoyed our conversation talking about cellular level, like all just getting really into the mitochondria and the very little bits that make up everything. So
Yeah. Yeah.
definitely. Go back and watch those or listen to those, y'all, if you haven't met met Dr. Anderson yet. This time around, we're going to go down the rabbit hole when it comes to heart health and how that kind of pairs up with TPE, Therapeutic Plasma Exchange, and probably a lot of other things that I'm yet to discover from you. So where would you normally, I guess, start the conversation? You just had a whole event.
We had, of course, different speakers speaking about, different aspects of, especially prevention of cardiovascular disease, but also treatment, along the lines of what can we do beyond the standard drug therapies, for example. And so one of the areas that I really delved into to try and do some pretty deep presentations on was the crossover between environmental exposures and environmental toxicity, and then various types of cardiovascular disease. And in regard to kind of what we want to talk about today, I think those are the areas I was most excited about kind of getting back into after spending a lot of time looking at different research that's been done and things that have, maybe we didn't know or we didn't know really well 10, 15, 20 years ago. We know a lot more mechanically about. But it turns out that there is a huge crossover in increased risk for almost all types of cardiovascular disease that we commonly see anyway. Things like hypertension and hyperlipidemia and other cardioinflammatory processes. There's a huge crossover between those and increased risk with increased toxicity exposure. So I thought that was a really great place probably for us to kick off.
Absolutely. Well, and yeah, we could kick off there. And also, I'm curious about any new research or at least big things that we, as probably those that aren't so in the cardiovascular space all the time, like what should we be looking at or knowing?
If we take the last 10, 15 years of diagnostic capability, certainly there have been, a lot of more, beyond the standard, you could say, diagnostic capabilities for quite a long time. But I think if we look at the technology available for your, more standard blood tests and then some of the, added risk factor blood tests that we have, we're in a better place than we've ever been to really predict whether or not your risk factors are really increased compared to, the rest of the population that you live in. And, certainly there's always those outliers where they may have no risk factors and they still have disease, or there's the other people that have all sorts of risk factors and they never seem to have any problems. But, most of the people, it really does follow that if you're having increased amounts of inflammatory triggered, cardiovascular findings on your labs, increased amounts of maybe genetically triggered cardiovascular findings in your labs and things, your risk does really correlate to that. And I think it's almost, sometimes we feel like we have too much information in some cases, but I think we're at a really good place for, we can look at you biologically and biochemically and then say, okay, is there a piece of this that's maybe genetic, but what can we do to modify those things? And then, what I really saw in working with these other specialists and presenting more along the idea of toxicity and inflammation was that is as important of an area to handle in cardiovascular risk as your diet, which is super important, and exercise, all the things that we
Yeah.
think about. And we don't often think as much about toxicity or environmental impact. And it's a huge risk factor that's modifiable.
Well, yeah, and I guess let's talk about that and how you see the importance of that crossover because it's not this or that. It's an
Right.
and.
Yeah, and I think with environmental factors, there's a number of ways to look at it. So one thing is you might start out and maybe you have some family history of cardiac problems, or you don't have any family history, but you get all checked out, and your provider says, well, these markers are high and they shouldn't be, or these are low and that shouldn't be. Here's the things that we can do about it. Normally, there'll be a recommendation maybe for a pharmaceutical intervention. Most of the time, at least, there should be a recommendation around your diet and potentially exercise. So those are kind of your common, areas of intervention. And then people will sometimes look at the genetic part of it because there are things that we do inherit, and they'll sort of skip over the part that we can modify some of the genetic that we do inherit.
Hmm.
So, for example, while genetics are the code, sort of like the recipe, your epigenetic signature is what turns the code on and off and all of those. Well, that's one huge area where environmental toxicity can kind of plug in, is one of the big triggers for an epigenetic turn on of maybe some bad genetics and all of that
Yeah.
is being triggered by toxicity and environmental exposures. And then the other thing, which I knew was kind of in the research, but until I was preparing some of the talks and realized how much, is beyond those, maybe your genes get sort of bruised up by the environment you're in and the toxins. Beyond that, the number of diseases and disorders in the cardiovascular system that are directly connected to higher levels of toxicity, giving us higher levels of, cardiac disorders and disease. I think that's an area that's largely overlooked because up until now, maybe it was a little hard to figure that out. It maybe the data about it wasn't as clear and compelling as it is now. And then I think that, even to the point of what we talked about last time, the ability to do anything about some of the toxicities has really been, kind of a big question mark in medicine, I think.
Yeah.
And so that's why, and we had Dr. Savage there. He did a presentation and kind of went through the very ultra specifics of TPE and the cardiac crossover. So I think now we have more interventions that make sense and that we know more scientifically about. So I think that's a real positive thing.
It is, yeah. The fact that we have the ability to do these modifications or somehow intervene in new ways, and like you said, it's and just like Dr. Savage, it starts with the data. So there's better testing, more testing, right? With blood testing, genetic testing, and it sounds like with it's interesting that the genes, they are modified, and like you said, they get bruised up. So by toxins or outside influence they're changing these genetics that might not have been turned on, right? Otherwise.
Right. Yeah, or enhancing, because the thing with the way our genes work in some places, so some people say, well, what if you have a inborn, cardiovascular, a plumbing problem that you inherit? That's sort of a different type of genetic problem.
Got it.
But your genetics that might be encoded for how much LDL you make or how much inflammatory chemicals you make or other things, those can be very directly either up or down regulated by how much toxin and other epigenetic trigger is there. And so there's ways to say, yeah, you're going to have a harder time if you carry these genes into it, but you don't have to pour fuel on the fire, and make it worse by keeping toxicity and toxicants around. And another really interesting thing is genes. A lot of what genes encode for are enzymes that help us to do, make products in the body and go through biochemical processes and pathways. It turns out in some of the more, you maybe just say negative things that we don't want to make biochemically that for our cardiovascular system, a lot of them are directly turned on by extra toxicity, especially chemical toxins and things like that. And so the more of those you have, it's like, well, you could have the most perfect genes for all those enzymes, but if the chemical toxins turn them on so they all go into the direction of, inflammatory mediators and things we don't want,
Yeah.
that's something we could remove or lower in the person and actually change the outcome.
That's interesting. Yeah. Well, it seems like I mean, I guess what's your take on this? Like a general, most of the doctors that are looking at people with heart condition or maybe just testing for hearts, like, is this overlooked right now? The fact of how toxins are playing this key role.
Oh, 100%. Yeah. It's one of those things where we wouldn't be having people writing, research papers and doing research about it if it wasn't known about on one hand.
Yeah, that's
But
true.
does that mean that it's worked its way into the way clinical medicine deals with these things? Most of the time, no. No. Environmental toxicity is still sort of this, blind spot, I think, clinically for not everybody, obviously, but for the majority of people. So if you go into your doctor and you've got, some out of balance cholesterol things going on and some family risks, they're going to focus more on, well, would a statin be right for you or this other drug? They're probably going to talk to you about changing what you eat, maybe talk to you about exercise. But when it comes to things like environmental exposure and toxicity, that's not a part of the way most medicine is practiced right now. So, and they might even know it's a possibility, but they don't have any way to treat it. So
Right.
it kind of gets overlooked. Yeah.
Yeah, because you mentioned statins and the typical
Right.
exercise diet, which is
Right.
it makes sense. But you're right; it's kind of overlooking the other factor that could be kind of completely changing the whole
Y-
game.
Yeah.
Yeah.
Yeah. And I think, like you said earlier, it's not either or. It's just if we have three areas we're affecting usually with our patients, and there's a fourth or fifth area that we could add in, that would be a really wonderful thing because it makes all the other stuff work better.
That's right. Well, I'm thinking of our last chat about cellular health and all that. Are there Are there any obvious changes that happen that precede a serious heart event or some heart issues that maybe we can kind of be aware of or notice ahead of time?
Yes, the big picture answer is yes. Some of them we can kind of see either the cause or maybe the effect of in laboratory testing. You always hope that you find these things before you have some cardiac event that, then they're working backwards.
Mm.
So the normal testing that is done, say with your cholesterol, for example, and triglycerides and maybe some of your blood sugar things, those are looking at this mixture of how your genetics are set up to make these things in our body, and then how our body interacts with our genetics through the diet that we eat and how much movement we have and all of the things that go into making these things. And so our our markers that we look at can be some of the first things before we have a problem to say, well, these patterns in your LDL and your HDL, or maybe these patterns in your inflammatory markers that directly affect your cardiac system. Those are things that need to be looked at, and then we are going to stratify your risk based on that. So that's kind of the first layer. Then more and more clinicians are using some of what I consider the next layer of testing, where they might actually break down, the LDL into there's like better and worse LDL, and so they might do that test, and that's very helpful.
Yeah.
There's some other markers that are very, very predictive of future problems that we don't normally add into the regular panel. They might be doing that. And then there's sort of a third layer where there's a lot of these kind of, okay, the biochemistry can either be in a less inflammatory mood or more inflammatory mood. And we look at, these markers that come out the other side that show, oh, you're processing these chemicals that affect your cells in an okay way, or you're processing them in a way that's very inflammatory, and we should not have that going on. So I think that's one thing. And then on the other side, and it's an evolving science, but when you get to the environmental effects, you have all sorts of different types of environmental toxins that you can look at. Metals are fairly easy to test. Some of the biological toxins or biotoxins, like mycotoxin from mold, we're getting better at testing that. Chemicals can be tested much easier than 10 or 20 years ago. So there again, if you have a person who's really high risk, and those other things aren't being looked at, it really does round out the assessment of that person.
Hello, my name is Carrie Stewart, and I did the brain protocol for the MD Lifespan. I was struggling to recall names of couples, and so I shared this with the doctor. That's when he introduced me and said, I think you're ready, and let me explain to you TPE, because this is going to help your memory, your focus, your clarity, and I truly believe you'll be a wonderful candidate for this. I have had 5 TPE protocols, and each time I have improved. And it's not until this last one that I am feeling so back on top of my game. Like my brain fog is gone, I am focused more, I have more clarity. This was life-changing for me, and I feel so much better for it.
I mean, this kind of leads to TPE and how I'm just curious of how you're thinking and with the use of therapeutic plasma exchange and what you're doing here with the cardio side and some of these traditional, I guess, what does that crossover look like? And we can kind of drill into some of those points.
Yeah, I think, if we look at the way that TPE works, where you're essentially removing large amounts of proteins that we've made that are, floating around in our blood and temporarily replacing them with a pure albumin product, and then so obviously some other nutrients and fluids and things. The idea there is that you have this constant movement from mostly your liver, a little bit your bone marrow and other places, where you're going to make these proteins, and then they're going to do their normal job, which is plasma proteins do all sorts of biochemical things, but they also are going to hold on to things. They're very sticky. So they're going to hold on to toxins. All metals can be on there, chemicals, mycotoxins and stuff. So if we go through and as part of what we're doing, we do a TPE procedure, then all of that mess of chemistry that was bound to your proteins leave you. And then you give your body a little bit of time, it recovers, it pushes a little bit more out, and then you do procedure again, and then that leaves. And so it's sort of a way to, almost irrespective of the type of toxin, it's a way to in a sense, use your natural plasma proteins as a way to mop up the toxicity and move them out. And then what really happens is then the less you have immediately available in your liver, then the more, as those plasma proteins circulate around, they might pick up toxicity from your cell membranes or other peripheral places. So it's really like, if you take you drain a swimming pool that's full of algae or something. If you drain it the first time, but you don't really clean out the walls and all of that, drain it again, you're going to get cleaner water each time, but until you get down to that base layer and you have less of the algae floating around, you're not really going to get nice clean water. So
good analogy.
And it's you're just it's not like any human can ever be completely toxic or completely non-toxic, but the idea is let's take some of the stress off the body. And this is I've done lots of other types of detoxification with people, And they're very effective for different things at different times, whether it's sweating or, chelation therapies or other, detoxification therapies. This gets at it from a completely different mechanistic point of view. So it's almost like trying to reset the system and go from like lots of toxic exposure to a very low amount, and then your body can naturally do its job better.
Right. Well, it gets back to what we talked about last time, which is, well, take the stress of all the mitochondria, right? And it's reducing inflammation, reducing oxidative stress, right? And TPE, this plasma exchange is, I'm assuming, would then support other heart protocols or just in general, the practice of like diet now.
Yeah, it's a way to clean the system up so that then whatever else you're doing isn't fighting so hard against a system that's, bogged down by toxicity, et cetera.
Are you seeing people starting to take this approach with this specific in mind? Like, is it? I guess what's the timing that you see it used often? Yeah, in the TPE.
Right now, en masse in medicine, it's not thought of a lot, for prevention because normally a TP procedure is used for certain types of autoimmune or rheumatologic diseases or drug toxicities or, emergency type things. But what I have noticed just in the last 3 or 4 years of observing clinical medicine in places where they're more likely to be open to new ideas is there's a lot more discussion of and use of TPE by what I would consider forward-looking clinicians who are, looking to give the body every opportunity possible, to have the least amount of interference, essentially. Yeah. So I see it, if we look at those who probably would be more likely to be doing this and using TPE, whereas 3, 4, 5 years ago, I might have heard 1 or 2 doctors or centers talking about it rarely. Now it's much, much more common, in that community to say either they're looking for a place to do it or they're doing it themselves or, something like that. So I think that's a good sign that it's catching on, that we don't need to just use this for, big bad autoimmune diseases and toxicities from drugs. Yeah. We can use the same technology for prevention.
Yeah, and it seems like, I'm sure education, I mean, you're a big educator on YouTube and, you put a lot of work out there, your books,
Yeah.
plural books, right?
Yeah.
I believe.
Yeah.
Yeah. So, and maybe that's the case here. I mean, that's what we're trying to do with TPE on this podcast, of course, is just bring it to the world in different ways. And ideally, maybe it's, when someone's told, hey, you're a heart attack waiting to happen or some other way, there's an approach that's a little bit, it's a little bit better there, maybe even quicker than, hey, just eat a little cleaner.
Yeah. Speaking of that, as far as there's some very AI interfacing testing that we can do now that really we couldn't do before. That actually can look at some of the more literally soft markers of vascular damage and things like that, where in the past we might have to wait and you get maybe a high calcium score and that doesn't associate with, very good things, but you couldn't tell from that whether is it the better or worse kind of high calcium score, or what's going on inside the vessels. Now we can actually see, using sort of an AI interface with that technology and others, you're literally a cardiac event waiting to happen, but we're seeing it way earlier.
Oh, wow.
That would be, one of the many times where I would say, I wouldn't just, I would do all the normal stuff. I would change my diet and do all things, but I wouldn't wait around, to become a worse, a worse candidate. And so doing something like a series of TPE to also kind of clear the decks from a toxic inflammatory point of view really makes a lot of sense there. I mean, the ideal would be don't wait till you're, about to have a problem or you've had a problem. But now that we have a lot more earlier warning sort of testing we can do, I think certainly if I saw that or if I see that in patients, it'd be like, yeah, there's all the normal stuff, but there's this whole area of toxic inflammatory load that those treatments don't really get to. And if we can do this with you, it takes another big brick off the pile, as far as risk factor. Yeah.
Right. And that's what I love, the way you break this down and how it goes all the way to the mitochondrial level. And it's like, yeah, if it's, if it's bringing in all the gunk, it's almost like the pool analogy. It's like, how do you think your body's going to function? And then you layer in genes and all these different factors that we individually hold.
Yeah.
At least now we know testing can help us identify this, but we also have things like TPE to help actually clean it in a mechanistic way than the other ways.
Definitely.
I guess, and to wrap it up here, what's exciting? I guess what excites you the most with what you said testing has been coming around. You mentioned AI. We're talking about TPE. Is or maybe a combination of this. Like, where do you see things going the next 5-10 years that excites you?
Specific to the cardiovascular risk in a person, we are at a better place than any time in the past to be able to see big trouble before you have a heart attack or a stroke or some other event that you don't want to have. So I think between better lab markers, better imaging of the actual cardiovascular system, that uses AI to inform it, so we actually know what's going on. I think if we put all those together on the diagnostic side, we can intervene in people long before, hopefully, they have any problem, and have the need to do, everything that they possibly can. So I think if you take that on the cardiovascular side, plus our ability to more effectively test for all of the toxins and toxicants that go on, and we're all exposed to so many of them. It's not, it's not like we're not going to have them, but some people are really, really full of them for various reasons. So if we see we've got two big risk factors, before you have a problem, we could kind of pull out all the stops. We do the dietary stuff. We do maybe nutraceutical interventions or drugs or whatever, but also you could do TPE to kind of take care of all of the chemistry stuff that, a drug's not going to fix and nutraceuticals aren't going to do that much for. And your diet change will help, but it's not going to take care of the toxicity. So I think it's a nice kind of collusion of new technologies that can help both on let's find your problem before it's a problem, and then let's treat your problem before it's a problem.
I would add a third on there is like the education layer. So like, there's a lot of media now coming around this, and AI can help with that. Yeah.
A lot of clinicians really, and many patients, of course, don't even realize there's been these changes or that these things are available. So I think that's, the education side is it's a huge need.
It is, and that's the key thing I keep thinking of with this podcast and show. It's not just general population. It's people actually in the trenches, people working on this every day. But everyone's so focused or busy or overwhelmed. They're just trying to stay with what's happening now.
Yeah.
So things are moving fast. Well, Dr. Jensen, I appreciate you. Where is the best place people can go to deep dive into your books, YouTube, anything else you have out there?
I have a hub website that's got all the links on it. It's DRANOW, dranow.com, and that has the YouTube links and the books and my professional websites and all, pretty much everything there. Yeah.
Beautiful. You keep it easy. I like
Great.
it. So we'll link it all in the show notes description.
Thank you.
Appreciate your time so much again, Doctor.
Hey, thanks again.